Thank you, Honourable Speaker, sir. I thank Honourable Samate for asking on behalf of Honourable Maharaj, who's not here with us. Nevertheless, I'll try and answer to the best of my ability on the question. Are you referring to PPP in general, or in particular Aspen, Noto Hospital, or the GP scheme? In general, eh? Okay. So, nevertheless,
He's fired the question, and the question, the bullet still hasn't landed, so he's made some adjustments again.
so I'll answer the question based on what we as a ministry faced, not from any survey done, but what we as a ministry faced. There are benefits of PPP, as you are well aware, and as previous government, you should be well aware of the PPP arrangement and how it was brought in during COVID, and the PPP arrangements with Aspen. Basically, you would know most of the answers to this question. As we would say in Tabunia, asking Taroin Kelly, you ask and you know the answer. But with that being said, Honourable Speaker, I'll try and answer it first from the perspective of PPP with GPs and what the ministry is also doing in terms of the new arrangements and the programs that are in place, and touch a little bit on the issue with Aspen. Just before touching on the benefits, since taking office, we've noted the challenges in trying to ensure that the PPP program goes ahead, and at the same time, in terms of monitoring and evaluation, the impact it has on why it was made in the first place. You are aware that it was done during COVID to assist the busy schedule of the public hospitals, but then it moved further. So there are numerous PPP together with health and the private sector. It has to do with laundry, security, and other services which are being outsourced when the need arises to radiology and things like that. In terms of the benefits, as we speak, and PPP arrangements, we have the free medicine scheme, PPP with GPs involved. 59,000 individuals have been registered under the free medicine scheme. This figure is till to date. In the kidney dialysis subsidy scheme, 490 individuals have been registered, currently doing. As for GPs, 17 are engaged under the GP scheme as of 2021, and currently 59 GPs engaged in the scheme to date. 54 hospitals have been outsourced security services. 5 hospitals have outsourced housekeeping services, which is CWM, Lambasa, Nandi, Singatok, and Navosa. With any agreement, there are also risks, and if the preparation or the preparatory work is not done right, then what we are currently experiencing at the moment is the risks from those issues. Some of the risks include poor understanding and application of the concept of PPP, weak institutional capacity in the public sector agencies, donor-driven PPPs that lose momentum and the interest die down, lack or weak monitoring, that is an area we are trying to improve on, limited sustainable resources, political affinities and inability to sustain the PPP arrangements, and peace and order at PPP site. Mr. Speaker, sir, with that being said, the arrangement between government and the healthcare Fiji, which is the concessionaire on Aspen, on how to manage Aspen. As it is, they've brought in new services that has improved the quality of services at the Lotoko Hospital, a modern A&E department, radiology equipments, new radiology equipments, a theater. They now have a cardiology unit which tends to look after, I can say, low-risk cardiac cases, open cardiac surgery, and other areas within the Lotoko Hospital, and also the Nyumba Aspen. But again, the benefits are there, but in terms of how planning was done, I believe it was not done properly. Since taking office, me together with the PS and our senior executives at the Ministry of Health, that was the first time we were looking at the concessional agreement. I believe if anything that has to do with health should involve health from the initial stages of the partnership. But nevertheless, it is something that government is trying to look at how best we can come out of it, because as it is, they are employing our former staffs, and they are providing a much needed services within the Western Division. So I've mentioned some of the benefits in both the PPP arrangement between the GPs and the current one we are having with Lotoko Aspen and Bar as well. And I'm willing to take questions regards to any clarification.